Let's talk about fatty liver disease. What it is, how to spot it, and what you can do about it before it's too late. Fatty liver, also called hepatic steatosis, is a condition that is affecting more and more people worldwide. In the United States, around 24% of adults have non-alcoholic fatty liver disease, often without even knowing it. Left untreated, fatty liver can lead to severe scarring, known as cirrhosis, and even progress to liver cancer. Early symptoms you need to watch for. Fatigue. Persistent tiredness is common, as fat accumulation in the liver affects its ability to metabolize nutrients and produce energy. Stomach pain and heartburn. Many experience gastrointestinal discomfort, such as heartburn, due to the impact of fat in the liver on digestion. Excess gas. This often results from changes in the intestinal flora, which can worsen with liver dysfunction. Pain on the right side of the abdomen. Discomfort may indicate an enlarged liver pressing against surrounding organs. Loss of appetite. Fatty liver impacts hormone production, leading to decreased appetite and nausea. Nausea, linked to reduced toxin filtration and liver inflammation, leading to digestive discomfort. Advanced symptoms of fatty liver. If untreated, fatty liver can progress to serious complications. Itching and jaundice. Accumulation of bile salts and bilirubin in the blood leads to itchy skin and yellowing of the skin and eyes. Pale stools and dark urine. These signs indicate that the liver is struggling to process bile effectively. Red spots on skin and spider veins. Poor liver function can lead to issues with blood clotting and hormonal imbalances. Gynecomastia and palmar. Erythema. Men may experience breast tissue enlargement due to hormone imbalance, and redness in the palms is also common. Night blindness and white nails. These symptoms result from nutritional deficiencies, particularly a lack of vitamin A and other essential nutrients. Swelling in legs and ankles, caused by reduced albumin production leading to fluid retention. Certain factors put you at higher risk for fatty liver. Obesity is one of the main culprits. Excess fat leads to inflammation and impairs liver function. Then there's type 2 diabetes. Insulin resistance is a significant contributor to fat accumulation in the liver. High blood pressure often coexists with obesity, further increasing the risk. Excessive alcohol consumption is another major factor. Alcohol is metabolized in the liver, causing inflammation and oxidative stress. And let's not forget about a sedentary lifestyle. Lack of exercise directly contributes to fat buildup in the liver. How to reverse fatty liver. The good news is that fatty liver can be reversed with lifestyle changes. First, avoid alcohol. This is crucial to prevent further liver damage. Next, exercise regularly. Aim for at least 150 minutes of physical activity per week to reduce liver fat. Losing weight is also important. Reducing even 5% of your body weight can significantly improve liver health. Lastly, adopt a healthy diet. Focus on whole grains, fruits, and vegetables, and avoid processed foods and sugar. Foods to avoid. Fructose and sugar, including processed sugars and high fructose corn syrup, are major contributors to liver fat. Ultra-processed foods are another category to watch out for. They are loaded with sugars, fats, and additives. Refined wheat and vegetable oils also contribute to fat accumulation and inflammation. Foods to include for a healthier liver. Fruits like avocados are rich in glutathione, which supports liver detoxification. Whole grains and cruciferous vegetables help reduce inflammation. Olive oil and turmeric are both anti-inflammatory and promote liver health. And don't forget coffee. It contains antioxidants that can reduce inflammation and prevent liver scarring. Final thoughts. Understanding these symptoms and risk factors can help you take action before fatty liver progresses. The liver has an incredible ability to heal itself, but it requires your support through healthy lifestyle choices. Check the description for links to all the sources we used today.